my name is Jennifer Perez. This is my YouTube teaching strategy presentation for teaching and learning strategies. Today I'm going to be teaching a customer service technique to a couple of nursing students, and we will be using simulation to help them to learn the technique fully. So we're going to start. Good morning, girls. My name is Jennifer, and today I'm going to be teaching you about a concept called AIDET. It is a way to increase your customer satisfaction and patient comfort. So as nursing students, it's really important that you have a strategy to increase your patient satisfaction. The way healthcare is now, there have been a lot of changes, and it's moving towards reimbursement being tied to patient satisfaction. And what that means is when somebody goes to the doctor or to the hospital, after their visit, they receive a survey. And if they don't rate that hospital or that doctor's office or that particular physician highly, then they may not get paid by the insurance company for that patient's visit. So it's really important that we keep our patients happy. And sometimes the patient's perception is different than what actually is going on. So by using this technique, it's pretty much 100% foolproof. It works every time. You can use this technique to ensure that your patients are happy. Excuse me. So I'm going to give you a little poster. And this is, AIDET is an acronym. The A stands for acknowledge, the I stands for introduce, the D stands for duration, the E stands for explanation, and the T stands for thank you. So the first thing you want to do is acknowledge. Excuse me. So today we're going to be simulating AIDET with an actual, well, not a real patient, but somebody that's volunteering that's going to be pretending to be a patient. So we're going to simulate a real patient visit. And it's going to be in a women's clinic with a OBGYN doctor, and she's coming in for her well woman exam. So the first thing you want to do is go into the room and acknowledge the patient. And you always acknowledge the patient by name, because that lets them know that you know who they are, and then they feel confident that whatever you're doing to them is for them, because you have lots of patients throughout the day. So if you call them by name, then they know that you know who they are. You're also going to introduce yourself. They want to know who you are. And you tell them something about yourself, something that's going to instill confidence in them that you're going to take good care of them. Like tell them how long you've been a nurse, or how long you've been in this field, or how long you've worked with such and such doctor. And talk up the doctor as well, or talk up your other colleagues. Like, I am Jennifer, and I'm going to be taking care of you tonight. Your medical assistant, so-and-so, is also going to be taking care of you, and they have been doing this for however many years. You want to make sure that the patient feels confident in all of the people that are taking care of them. You're going to talk to them about the duration, which is the amount of time they can expect for anything to take. And this is a really important piece because you want the patient to know what to expect as far as time. You know, when you go to a doctor's office, nobody likes to wait, but if you know what to expect and you know how long you're going to wait, it doesn't seem like it's as long. So you're going to say you can expect to be here for 45 minutes or an hour or however long it's going to take. It's just an estimate, and we'll keep you updated if anything changes. Explanation. You want to let the patient know what to expect as far as what we're going to do. This patient that we're going to be simulating with today will be getting a well woman exam, so we'll tell her you're going to be receiving a pap smear and a breast exam, and let them know that you'll be in there with them the whole time so they feel comfortable, and that you're there to answer any questions they might have. And then the last piece is that you definitely want to thank the patient. You want to thank them for choosing whatever the establishment is. And today we're going to say we're at JPS. So you're going to say thank you for choosing JPS. So now we have our patient. This is Lynn. She's going to be our patient today. She's coming in for her well woman exam. So we have her here in the exam room. The first thing I want us to do is, Emma, I want you to go in the room and I want you to just introduce yourself as you've been previously taught. Get her set up for the exam and for the doctor, but don't use AIDET.
Hi, I'm Emma. I'm your nurse. You're here for your exam. Here's your gown, and the doctor and I will be back shortly for your exam.
So about 20 minutes has passed, and you're walking past Mrs. Page's room.
Excuse me, nurse. I've been sitting in here for almost 45 minutes. I have other things to do. When are we going to be finished with this?
I'll go get the doctor and see if he's ready.
I just don't feel very confident in this whole situation.
Okay, now Morgan, I want you to do the same thing. I want you to go and introduce yourself to the patient, set her up for the exam, but I want you to use AIDET.
Hi, Mrs. Page. I'm Morgan. I will be your nurse today. I've been working with Dr. Perez for 2 years now, and his patients love him. Here's your gown. You will put it on over nothing. You will take off all your clothes and have that. It can be open to the back or front, whichever one you're more comfortable with. It doesn't matter. You can expect to be here at least an hour with waiting time and the doctor time. You are here today for a well woman exam. You will get a breast exam and a pap smear, and I will be in the office assisting the doctor at all times. Do you have any questions?
Well, so how long has Dr. Perez been a doctor? Because I'm new here.
He's been a doctor for about 25 years now.
Oh, good. Okay.
Thank you for choosing JPS.
Thank you.
Okay, so after she's finished with her exam, she's going to come out of the room, and Morgan, you go ahead and walk past the room.
Excuse me, Morgan. Here's my gown. I wasn't sure where to put it, but thank you so much. You really gave me a great deal of confidence, and I really liked knowing exactly how long it was going to take. I appreciate it very much.
Okay, so we're going to do a short debriefing. Can one of you girls tell me what was the main difference between the two scenarios?
In one, she knew what was going on, and then one, she didn't.
And how did she act when she didn't know what was going on?
She acted more fidgety and more antsy and unsure about the situation than...
And do you think if she received a survey in the mail that she was going to score this doctor or this facility highly?
No.
No. But after she received the AIDET treatment, how did she respond?
She seemed happy, more comfortable with what was going on. Even
Right.
though it was the same situation, and once she knew what was happening in the other one.
Because she knew what to expect, and that's the big important piece. Do you girls have any questions about anything? Okay, well that's AIDET. Go out into the world and use it.